Chicago Bulls guard Lonzo Ball continues to struggle with daily pain 1 year after undergoing arthroscopic meniscal surgery. Reports are that he has sought out multiple medical opinions trying to elucidate the etiology, figure out the cause of his daily pain. Let's take a quick look at what his medical team may be looking at. The knee joint is composed of 4 bones: the femur, the patella, the tibia, and the fibula. Removing the femur, we can see some of the inner structures of the knee, including the anterior cruciate ligament, the medial meniscus, which sits on the inside portion of the knee, and the lateral meniscus. The menisci are thin plates of cartilage that act as shock absorbers. Think of them as thin, delicate paper plates that can be easily torn. It hasn't been made public which meniscus was worked on, whether it was the medial meniscus or the lateral meniscus, but probability alone would dictate the medial meniscus. In addition, it hasn't been made known what type of tear he had. There are 2 types of procedures: a meniscectomy, where a portion of the damaged meniscus is trimmed away and removed, or a meniscal repair, where the tear is sutured. When trying to elucidate the cause of chronic pain, I'm sure they are approaching it in a systemic fashion, starting from the skeletal system outward. He did undergo a debridement procedure, which was a second arthroscopic procedure, which looks for an additional tear, a loose body within the knee, or some other type of damage, including arthritis of the articular cartilage, the cartilage lining the tibia and the femur above. When somebody is struggling with an injury to a joint, you always look at the joint above and below. So they are also evaluating his ankle for any issues there, and certainly the hip joint for any issues there. In addition, I'm sure they are evaluating his low back, his lumbar spine. The vertebral column is composed of bones, the vertebra, and discs, which are like jello inside of a container. A bulging disc in his low back can easily refer pain down into the knee area. So I'm sure they're looking at that also. In addition, there are several nerves, including the sciatic nerve, that course from the low back down into the foot. Certainly an injury or inflammation of any of the nerves on or about the knee joint can cause daily pain. Moving outward into the other structures, any type of quadriceps dysfunction due to disuse or atrophy can contribute. Patellofemoral syndrome, which is an abnormal tracking of the patella in the knee joint, can cause daily pain. And then, of course, the last structure they would be looking at is the skin. Any evidence of inflamed skin, pimples, lesions, anything that can inflame a nerve. Complications after meniscus surgery are more common than you may think. We all wish Mr. Ball and his family well and a speedy recovery.